In 1854, thousands of soldiers were dying, not from battle wounds, but from disease. Hospitals overflowed with wounded soldiers, infections spread faster than the bullets, and no one in positions of power thought sanitation mattered. Florence Nightingale is often remembered for her humanitarian work, yet what reshaped medicine was not sentiment, it was statistical analysis. Florence Nightingale sparked a revolution in medicine by introducing sanitation, statistical analysis, and organized nursing during the Crimean War. Despite facing resistance from military doctors and deep prejudice against women in medicine, her work led to lasting reforms in hospital design, public health, and nursing education, transforming healthcare into a scientific and professional field that continues to save lives today. Before Florence Nightingale, hospitals were not places of healing. Doctors believed disease spread through what can only be described as bad air, instead of the later proven idea that it was due to unsanitary conditions. Barracks Hospital at Scutari was called Hell on Earth by Nightingale, in the letters she wrote to her contacts in Britain. This description is similar to many other hospitals at the time. All of them had patients crowded together, poor ventilation, and basic hygiene was ignored. Death was often accepted as unavoidable, especially in wartime. So when the Crimean War began, the British military was completely unprepared for the medical crisis that followed. When Florence Nightingale arrived at the military hospital in Scutari during the Crimean War, what she found was deeply disturbing. The hospital was overcrowded and filthy, with sewage leaking into the water supply and contaminating the drinking sources. Rats scurried freely across the floors, spreading disease, while wounded soldiers lay packed together in the dark, poorly ventilated rooms. Many of these men were left untreated for days, forced to lie in their own waste with little medical attention or basic care. The conditions were so unsanitary that the hospital itself was making soldiers sicker instead of helping them recover. As a result, more soldiers were dying from preventable illness such as cholera, typhus, and dysentery than from the injuries they had suffered on the battlefield. To many officials, this level of death seemed unavoidable, a tragic but accepted consequence of war. Nightingale, however, refused to accept this explanation. She believed that these deaths were not inevitable, but a result of neglect, poor sanitation, and disorganization. She immediately took action. Nightingale organized cleaning crews to scrub the hospital, improve ventilation by opening windows and rearranging wards, and worked to secure access to clean water. She also insisted that soldiers receive proper nutrition, understanding that food was essential to their healing. Beyond these physical changes, Nightingale did something revolutionary for her time. She carefully recorded her data. By tracking death rates before and after her sanitation reforms, she was able to prove that these simple improvements were saving lives. The results were undeniable. Mortality rates dropped dramatically, showing that cleanliness, organization, and basic care could mean the difference between life and death. Florence Nightingale was not just providing comfort to the wounded. She was using evidence and data to drive medical reform. In doing so, she helps lay the foundation for modern, evidence-based medicine. Nightingale's work was far from welcome when she first began pushing for change. Many military doctors openly dismissed her concerns, insisting that sanitation had little to do with disease and that the conditions in the hospital were just realities of war. Others resented being told what to do by a woman in a profession that was overwhelmingly male. This gender bias shaped how seriously her ideas were taken. Rather than engaging with her arguments, officials often questioned her presence, her authority, and her right to lead. Even when Nightingale's data clearly showed that death rates dropped after sanitation reforms were introduced, many leaders continued to resist. Instead of challenging the evidence itself, they challenged her credibility, minimizing her work and delaying meaningful change. But Nightingale understood how power operated within institutions. She used detailed statistics, formal reports, and persistent political pressure to expose the government's failure. By presenting clear, undeniable data, she made it impossible for officials to ignore the truth. After the war, Florence Nightingale did not fade into the background. Instead, She worked harder than ever to make sure her impact on nursing and medicine would last. She was determined that the failures she had witnessed would not be repeated, and she focused on changing the systems that had allowed so many preventable deaths to occur. Rather than returning to bedside care alone, she turned her attention to long-term reform. Nightingale developed new hospital designs that placed sanitation and ventilation at the center of medical care. She believed that clean air, clean water, and organized spaces were not optional, but essential to saving lives. These ideas challenged traditional hospital layouts and pushed medicine towards a more scientific and preventative approach. At the same time, she published influential texts that reshaped how nurses and medical staff were trained, emphasizing discipline, cleanliness, and observation. One of her most powerful contributions was her use of statistics to communicate truth. Nightingale created some of the earliest data visualizations ever used to influence public policy. Her most famous diagram, known as the Rose or Coxcomb diagram, visually represented the causes of death at the hospital in Scutari. Through this diagram, she showed that far more soldiers died from disease caused by unsanitary conditions than from battle wounds. The clarity of this visual evidence made denial difficult. Officials could no longer ignore the reality that poor sanitation was killing soldiers. Her diagrams helped persuade leaders to implement reforms that permanently transformed nursing and hospital care. For the first time, medicine was being held accountable. Transparency, data, and evidence became tools for reform, changing healthcare forever. At the heart of Nightingale's work was an ethical belief that patients deserve dignity, caregivers have responsibility, and that preventable suffering is morally unacceptable. These ideas guided every decision she made and shaped the way she approached medicine and nursing. She believed that caring for the sick was not just a technical task, but a moral duty. Over time, these principles became the foundation of modern medical ethics. Although Nightingale's ideas were not without limitations, and were later expanded by other researchers, her core message endured. She insisted that healthcare must be both compassionate and scientific, combining empathy with evidence. This balance permanently changed the way medicine was practiced and understood, pushing it towards a system that values both human life and accountability. One of the most well-known examples of Nightingale's dedication to her patients is reflected in her nickname, the Lady with the Lamp. After long, exhausting shifts, she continued to walk through the hospital wards late into the night, checking on wounded soldiers and making sure they were comfortable. She often helped them write letters to their loved ones, offering emotional support alongside physical care. She carried a lamp to light her way through the dark corridors, becoming a symbol of hope to her patients. That she chose to do this voluntarily shows the depth of her compassion and commitment. Her actions embodied the ethical values she believed in, leaving a lasting legacy that continues to influence healthcare today. In 1860, she established the Nightingale Training School for Nurses in St. Thomas Hospital in London, creating a model for professional nursing education that spread around the world. She also wrote Notes on Nursing, What It Is and What It Is Not, a guide that remains influential and is still referenced in modern nursing practice. Today, hospitals track infection rates with the Rose diagram, and the public health relies on the data. Nursing is a respected profession built on training and high ethical standards. These systems trace directly back to Florence Nightingale's reforms. Her revolution didn't just save lives in the 19th century, it continues to save lives today. Florence Nightingale was more than the Lady with the Lamp. She was a revolutionary who challenged tradition, resisted injustice, and transformed medicine through evidence, ethics, and reform. In a world that once accepted suffering as inevitable, she proved that change was both possible and measurable.